Hi, I'm Dr. Michael Kennelly, a specialist in overactive bladder.
And I'm Linya Floyd, Health Director at Family Circle Magazine.
Today we're here to talk to you about a condition of overactive bladder. Specifically, that is a medical area where you'll have a sudden spasming. The bladder itself will suddenly squeeze without your knowledge or desire, oftentimes leading to that uncomfortable feeling, that urinary urgency, gotta go feeling, leading to a lot of frequency trips to the restroom, which is distressing. In addition, the most bothersome is where the bladder itself will suddenly leak without your knowledge or desire. And typically that's a call to action, that something makes women say, I need to get to a physician and see what's going on.
One of the reasons that we thought it was so important to talk about this issue is the education piece of the puzzle. So many people in the United States are struggling with this condition. 33 million Americans have overactive bladder. However, it's not something that you often hear people talk about. So we wanted to educate people about what the condition is. Maybe you have it and don't even realize it, or maybe you have it and you've been struggling with the symptoms, masking them, trying to figure out workarounds. But there is a lot that you can do in order to treat it. And number one is to talk to a physician. Go see a specialist so that you can get an accurate diagnosis and talk through all your treatment options when it comes to OAB.
And the keys that we found is that women wait typically 5 to 7 years before they eventually get to a provider. And once they get to a provider, they start some of the treatments, which may be self-help therapies, dietary modification, or maybe a medication may be prescribed. But sometimes the medicine itself isn't meeting the need. They may have adverse events, but they shouldn't give up at that point because there are new beyond therapies that really go into an OAB specialist. Some of the new therapies, such as Botox, when lifestyle changes or medicines are ineffective, have been very, very beneficial.
So whether you've never talked to a doctor about this before or you have and you're not experiencing good results with the treatment that you've gotten in the past, we really want to encourage you to go put yourself first, make an appointment, and talk to a specialist about your condition. One place that you can go to find more information about this condition is BotoxForOAB.com. At that site, you can not only find a specialist in your area by going to put in your zip code, but you can also download a journal so that you can track your symptoms. Really great starting point for talking about what's going on with you with your doctor. And in addition to that, you can also find on that site something that you can download in order to start the discussion with your doctor. So you can just kind of check off different experiences that you're having, and that starts the conversation, offers some questions about what you can do in order to improve your well-being.
The other key thing is that using some of the newer therapies, such as Botox, which are non-medicine based, actually have proven to have great results to decrease urgency and frequency, whereas up to 31% of patients actually can be dry with one treatment that normally lasts upwards to 6 months and has minimal side effects.
So bottom line, please put yourselves first, please prioritize your health, and make that appointment to talk to your doctor if you're experiencing symptoms.
The keys, again, are to get the correct diagnosis, find an OAB specialist, don't settle if things aren't working, take it upon yourself, treat your health as the primary important aspect, and I think that overall you'll see great success.